Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Mark Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you doing today? You look so nice.
I'm great. Thank you so much. How about you?
I'm living it up. Do you ever get sick of me living it up?
No. I love that you live it up. I never get sick of that. 14 years together here, and I want to hear that every time we talk. Every time.
It's been a nice, beautiful time we've spent together. And good old Dr. Gene before you. Dr. Gene, I tried calling you after the show last week, and I couldn't find you. So I hope he's still kicking, as they say.
Right. Yeah, I liked him a lot.
He's a sweet man.
So we are going to help our listeners feel like they're great and they're living it up. How are we going to do that?
We're going to teach them how to help fix and heal their orthopedic pain. That means the musculoskeletal system from the head to the toe and everything in between. Neck pain, back pain, arthritis, shoulders, hips, toes, fingers, elbows, you name it. And as you know, Nita, and a lot of my listeners know, I've been injecting myself for the last 25 plus years. I learned about this while I was a resident at UCLA in physical medicine rehabilitation. And it was a miracle for me. I had a wrist injury at the time, and I went to a conference about what we call regenerative medicine today. In the old days, they called it prolotherapy, or proliferative therapy, meaning to stimulate new tissue growth. And it's advanced quite a bit from the old days of using the sugar cure, as they used to call it, because we'd use concentrated dextrose to create an inflammatory response. And people don't understand that really. It doesn't make sense, because why would you create inflammation to heal?
I know.
That's how. Tell me.
Because the inflammation brings the immune system response to the area.
It does. It brings fibroblasts to the area, which are cells that grow new tissue, new collagen. So for an example, I always use this as an example because most people have had an ankle sprain and they know it hurts like crazy, but rarely does anybody get a surgery for that. And when it's in the low back or the neck, they often do get a surgery for it when it isn't needed. And most of the things that I treat, most of the people I treat come in ready to have an orthopedic surgery, and they don't need it because the paradigm of medicine has switched to repairing and regenerating tissue instead of cutting tissue out. So when I was in my training in orthopedic surgery, I loved it until I had a shoulder surgery. That didn't work too well for me. I'm going to give out the phone number, by the way, so we don't just blab for the whole hour. Get some callers in. So if you want to talk to me and Nita right now live, you can write this down. The phone number to the studio is 866-870-5752. I'm going to repeat it for you. 866-870-5752. And if you want to call at the office, there are people by the phones there too to get more information if we don't cover something that you are interested in. And the number to my office is 800-300-9300. That's 800-300-9300. You can also watch me doing these procedures on the internet on my website, which is www.jointrehab.com. That's www.jointrehab.com. And you can actually see if this is something you would rather do than get a surgery or just not get healed at all. Now, most orthopedic injuries actually do heal on their own. If you have a broken bone, obviously, and it's out of place, it's compounded fracture or something like that, or sticking out of the skin, that has a very low probability of healing itself, and you need to get an orthopedic surgeon right away to help you put that back together. So, John, you're waiting. You called in. We love you. John has neck issues. Tell us about it, John. What's going on? How long has your neck bothered you?
He does his knee, but mine is the neck, and
Okay.
I'm missing 5 and 6. The disc is gone, variated, and 6 and 7 is almost gone too.
Okay.
And I haven't been sleeping for a long time, like straight sleep for 6-7 hours. I haven't had it. So what's my solution? I went to too many surgeons. They didn't like. They weren't sure. They told me it will help your arm, the pain that radiates to your arm, but the neck,
Okay.
he didn't give me anything. The last one I saw at UCLA.
Okay. Terrific, John. Thank you for your call. Do you have any neck pain today?
Yes,
Do you have any arm pain today?
not as much, but the
Okay.
neck bothers me. It radiates to my torsos.
Okay. So the neck pain is usually pretty easy to fix, and we would use probably platelets and maybe stem cells to inject around the ligaments in your neck to strengthen it. And most neck pain is most spine pain is because of a sprain. Do you know how this happened to you?
To be honest with you, I cannot pinpoint it, but majority of it is at work. Majority
Okay.
of it, but I cannot pinpoint it.
Sure. And then the arm stuff, most of that goes away by itself. Not every case will. And there are cases where you need a neck surgery to get rid of the arm pain. But yours does not seem like it's a terrible thing. And often when we heal the neck pain, the arm pain goes away with it. Not always. So I would have to
Yeah,
examine you.
Go ahead, Doc.
I would have to examine you and touch the
Okay.
area. I don't really care what the MRI says if you had one. Did you have an MRI or just an X-ray?
Yeah, as a matter of fact, I have one that I'm going to do Monday too, because I saw another pain management. You know RFA, right? Radio frequency ablation.
Yeah, I wouldn't do that.
I know, because my neighbor did it so many times. Nothing. That's what he recommended, because I have headaches too.
Okay. I'd have to
Okay,
examine you,
I
John.
have your number. I'll call Monday and get an appointment with you, doctor.
Wonderful. You can call right now. There's people.
The 300-9300?
I'm going to give out both phone numbers. The phone number to the office is 800-300-9300. And the
Yeah,
phone
so
number
somebody
to...
will be there to book an appointment?
Yeah, someone can give you an appointment right now.
Well, I appreciate it, doctor. Thank you.
Well,
Maybe
God
this
bless
is
you,
my
John.
miracle I've
Yeah,
been waiting for. You have a blessed day also.
From what you're telling me, there's good hope we can heal you up. No promises. I have to do an examination, see what's going on, and tell you
Okay,
your
sure.
chances of healing. All right. You have a great
Thank
day.
you, doc.
Thanks for your call,
Likewise.
John.
Be safe on the road. It sounds like you're driving.
And our number is
866-870-5752. That's 866-870-5752. And besides healing the musculoskeletal system, which means the joints and the tendons and the ligaments, bones and whatever, there is also treatment in our office using the same cells, platelets or stem cells, for the face, and that's called the vampire facelift. And the Kardashians made that famous years ago because they had that done. They got to look good, and this will help you make you look good too, because it grows the tissue back in the face. The collagen grows back in the face. Wherever we put these cells, tissue is stimulated to regrow. It can also be used on the top of the head if the hair is thinning, and it revitalizes the hair follicles. And that's a very simple treatment to do also that we can do for you. So once again, We're getting some callers in here, so get in line quick. Call 866-870-5752, and I'll talk to you live right now. That's 866-870-5752. And if you want to just call the office directly, you can call 800-300-9300. So Jim is calling in right now. Jim has low back pain. Jim, how long has that been going on for?
It started in December, so almost 6 months.
Okay. And was there any activity that did it, or it just kind of came on by itself?
No, it just came on by itself, and then when I went to play ball that day, it felt like I was an old man where my back was stiff, and then I would take Advil. It would help to relieve it, and then I saw my back doctor, and he said, try to do some physical therapy. So I did physical therapy. He said my SI joint was out of alignment, so he got that okay. The pain mainly radiated into my glute muscles, and at first it was like a burning sensation, and that seemed to go away once he got my SI joint in alignment. But then after that, it was just like a chronic dull ache in my glutes, and once in a while it would go down the side of my calf, like a little tingling. But mainly it's and when I sit down, I don't feel it at all. So I can be sitting down, nothing. But when I'm walking or standing, I feel it, and then I have to ice it. And I still do the back exercises. And his next feeling was to get an MRI and possibly do a cortisone injection. He gave me some steroid pills, Medrol, and that completely got rid of the discomfort for the 6 days that I was on that. And but then after that, then I could feel it coming back. So he said, we may need to do a cortisone epidural in L5S1 because I've got a lot of osteoarthritis in all my lumbar areas, but especially in L5S1.
Okay. So may I respond to all of that? That's a lot of great information for people to learn from, which is what we like to do on the show.
Sure.
Okay. So you've had 6 months of back pain. And what kind of ball do you play? Baseball?
No, this is pickleball or racquetball.
Oh, pickle. Okay. My practice is very grateful for pickleball. Do you know why?
Why?
Because
You like
probably
pickles?
I do like pickles, but about 20% of my patients come in because of injuries from pickleball. It's it's the hottest rage now. And typically, it's moving from older people to younger people, but older people who are kind of out of shape get into the pickleball ring or the court and really beat themselves up pretty badly because it's so much fun. So I get a lot of patients with back pain, arm pain, neck pain, foot pain from pickleball. So be careful. That's all I can tell you. It seems
right. No, I know,
from the name pickleball, it sounds so innocuous, but it's a
Right.
fast game, and a lot of people get hurt from it who are not in real good shape. So I'm sorry that happened, but I think we can fix you up. And I would not do any of the things that are being offered to you.
No cortisone, you're saying?
No, I wouldn't. I don't like putting cortisone in the body. I rarely do. Once in a while I do. But that would be a really terrible case, not like yours. So let me just talk for a while without you asking any questions. Then when I'm done, you can ask me all kinds of questions. So you already had a Medrol dose pack, which is a stiff dose of a steroid. I don't ever give those to people because occasionally you can blow out the hips and kill the hip joint from those. There's a very small artery that goes to the hips. And for some reason, when people take Medrol dose packs, it can occlude those arteries, and then you end up with hip replacements. So I wouldn't ever do that one. So that's one that I'm not in favor of. I know doctors give them out all the time, but I've had a couple of doctor friends who actually took it, or are more traditional than I am. I'm considered outside the box because I do things more empirical. That means I do things that work, that I see work, not things that are more textbook that doctors in traditional medicine just do, because I don't see those things work real well all the time. And then you've just got a little bit of tingling in the calf, so I'm not gonna recommend an epidural for that. I'm gonna
No,
recommend
not for that. I think it was for the calf or for the glutes, that where it goes into the glutes, because the calf thing is only occasional. It's mainly where I've always got a dull ache in my glutes.
All right. So you didn't let me finish. I would use regenerative medicine, platelets and or stem cells around that glute muscle. I do those every day, and people get better without steroids, because what we do with this is we, in a sense, reattach the muscle. It's called the enthesis. So I'm betting anything you have what's called an enthesopathy. And most doctors don't even know what that is. It's where muscles, tendons, and ligaments attach to bone. So I would inject where that muscle attaches down to the bone. And I think we'd probably get you healed up. I have to examine you first to see what the story is. Now, you said that
So
your
you don't
SI
think
joint...
it's coming from the nerves being pinched at the L5S1 then?
I'd have to examine you first to tell you. I doubt it.
Huh.
So you always want to do
Okay.
the most conservative and natural thing in medicine, and that would be using regenerative medicine with your own cells, platelets or stem cells, rather
And
than
how long-
putting...
How long does it take before you would notice an
Let's make a
improvement if you-
deal, Ewan. Let's make a deal. Write down your
Okay.
questions and let me finish,
Okay.
because I can't get my thoughts out. And I'm going to give you plenty of time to ask all your questions. So I'm off track now here as to what I was going to tell you. I don't know a thing until I examine you. That's number one, okay? So I have to examine your body to see what's going on. I don't believe in x-rays or MRIs or CT scans for most things to tell me what's going on, because they often are what I call a red herring. That means that they show things that look bad, but they're not the pain generator that looks bad. I use my hands to find the pain generator, if that makes sense. So if you have an MRI and it shows that you have a herniated disc sitting on a nerve, that doesn't mean you're having any pain or any radiculopathy, meaning pain down the arms or legs or into the butt. And we know that because we do studies on people that have no pain, and we find impinged nerves, we find herniated discs, we find meniscal tears in knees, we find rotator cuff tears in shoulders, we find labral tears, we find all kinds of stuff, and then we tell the person, they go, "Get away from me. I'm fine. I don't need surgery. I don't care if I have that because it's not bothering me." So don't mix it up and think because your doctor gets an MRI and shows you something that that's where the pain is coming from. It may not be. It may be, but it may not be. And the only way to find out is for the doctor to use his hands and do an examination and pinpoint the spot and then work on that spot. I don't fix MRIs or x-rays. Do you get that? I'm here to heal people. And I can't do that through films. I can't do that through images. So let me see if you have any other questions that I
Your
wrote
call
down.
did not go through.
Jim, did you hang up on me? Jim, are you still with me?
Hi.
Well, Jim, if you're still listening, you're welcome to call back at the studio at 866-870-5752, 866-870-5752, and it'll be your turn to ask as many questions as you like, and I'll be very happy to answer them. So I'm going to say it like this, and also Jim has some osteoarthritis in his spine, and that does not mean that causes any pain. As people age, they often get osteoarthritis all over the body or certain parts of the body and have no pain from it. And we know this because we do studies on people that have no pain and get images and find out they have arthritis but they don't have pain. As an example, my right shoulder has 2 rotator cuff tears, the subscapularis and the supraspinatus, and I have a labral tear in my shoulder. I have 0 pain in my shoulder. I have injected it though. when I inject a shoulder, I do what's called a comprehensive treatment. I will inject things that look bad, like those tears. I will inject that. But I still have my tears, but I also inject all over the shoulder. And I had another doctor come in to shadow me yesterday, and his technique, God bless him, was to inject the parts that look bad on the images. So I had a patient, I asked the patient, do you mind if this doctor injects you? And the patient was a very nice man, and he said, yeah, go ahead, let him do it. When this doctor finished, I then injected all over the shoulder, because we can't rely on an image to tell us where pain is coming from. And I touched this patient's shoulder and I said, does it hurt here? He said, yes. I said, that's not the spot where you have the tear. And then I injected that spot. There's a lot of things that can cause pain that you can't see in an image. So we have to be very careful to do an examination. And the sad thing is, many people come to me after a failed surgery. They get a surgery and they come back to me afterwards. I don't send them to the surgeon, by the way, to get surgeries. They come back to me and said, I went to an orthopedic surgeon, I had a surgery, the pain got worse. Why? My question is, did that surgeon examine you with his hands? And the answer 99% of the time is no. They did an MRI and showed me what needed to be operated on. And that, to me, is not the best way to deal with the patient or heal them. And I'm not putting down orthopedic surgeons. I love orthopedic surgeons. The reason? Because that's hard work. So, Jim, we got you back on the phone. Your call was lost, and you're the guy that has low back pain. I answered all the things that you mentioned before, but if you have more questions, go ahead and hit me up with them now, and I'll answer them for you.
Right. So basically, you were saying that if you did a physical exam, you'd be able to determine if what you're saying about that, I can't remember the name of that term that you use where you inject into the glute area.
Yeah. That term, you can write it down if you want, is enthesopathy. It's a hard word. E-N-T-H-E-S-O-P-A-T-H-Y. Enthesopathy.
Enthesopathy. Okay.
Yeah, but so to shorten it down, you can just look at enthesis. Pathy just means disease, but it's not like a disease that hurts you, kills you. It just means that there's something wrong. And for you folks that like to use Google to see the anatomy, and you can do this with the word enthesis, type in enthesis, and then on the upper left-hand corner of Google, there's a spot you can click on that says images, and you'll actually see the anatomy there. And on this, in this case, from what you're telling me, Jim, your gluteus medius muscle is attached to the pelvis, and at that attachment site, we call that the enthesis, and I call that an enthesopathy. So I would, if that is the place that I find by touching that area, then I'm going to inject right down to the bone there. It's a very easy thing to do, and put some platelets or stem cells there and heal it up. Same thing anywhere in the body. The most common thing that I see with people, I mentioned before, people get an ankle sprain. They don't go ahead and get MRIs. They don't think about getting surgery, but it's the same injury that you probably have in your back. So why would people consider getting a back surgery?
Right. And so
don't ask me. It makes no sense to me. But I got to tell you, I've been trained at UCLA in traditional medicine, and I think there's a lot of hogwash in it.
Okay, then I'll make an appointment. How many sessions of, if that's what you had to do with the injections, how many sessions would that entail usually?
I have no idea.
Okay.
Everybody's different. People say, what's the average? I say the average for an enthesopathy is 1 to 3 treatments. But I can't tell you. I haven't even touched your body yet to find out. So thanks, Jim. If you want to hang on and talk more, you can. We're going to the break. I'd love to get some more callers, and you can reach me after the break at actually you can call now, 866-870-5752. You can watch these treatments on my website, www.jointrehab.com.
And we'll be right back after this.
You're listening to Living Pain Free with Dr. Mark Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.